Good morning. I'm Dr. Farzaneh Haratian, a psychologist in supervised practice at CPBAO under the expert and clinical supervision of Dr. Wendy Ledoux and Dr. Bahirai. If you're watching this, it shows that you have taken the first courageous step toward healing, and I am very much privileged to accompany you on this journey. In our clinic, I have been adopting different approaches, evidence-based modalities like ACT, acceptance commitment therapy, DBT, dialectical behavior therapy, CBT, cognitive behavior therapy. I'm coming from two disciplines of English literature and psychology, and I have found that narrative therapy, that is all about re-narrating, re-authoring, rewriting, reformulating, redesigning of your life, to look at your life from totally fresh perspective outlook, to add a new chapter to your life, has proven to be very much useful and effective with different disorders. It was developed in the 1970s and 1980s by Michael White and David Epstein. And the core principle is revolving around the idea that you are not the problem. The person and the problem, they are totally different from each other. So we need to externalize the problem from your core identity. You are not the problem. The problem is there. Together, through a collaboration, we are going to look at the problem from different angles. The one that has been inflicting you and has made you suffer and has forced you toward negativity with some destructive habits and patterns in the mind. Narrative therapy is deeply rooted in clinical science. I have found something here like decades of peer-reviewed research and randomized controlled trials demonstrating that narrative therapy is highly effective for a wide range of clinical conditions, from depression and anxiety to trauma and PTSD. The idea is very clear. Shifting and changing the internal story and narrative would definitely affect your present and future, the way you look at it, the way you want to build and design it, and affect how your brain processes information, processes emotion, and processes emotional distress. It can significantly boost your well-being, emotional stability, psychological well-being, and the belief in your ability and potential to heal. Some people might ask how it would look like in our sessions. As your therapist, think of me as the co-author, co-builder, co-designer. Together we're going to reformulate. Together we're going to rewrite a new chapter, not erasing or disregarding or ignoring the past, but to look at it from an entirely fresh outlook and perspective. We're going to remember and recall the various good moments, those treasures and gems in your life that you have been struggling, you have been resisting, and you have been surviving. We're going to find those good moments that are the proof of your resilience and are like treasures in your life. For this therapy to be truly collaborative, you need to see me as a partner, as a collaborative partner. And your role is simply to be as open and curious as possible. You don't need to have the answers right away. Your job is merely to join me in looking at your life, at your past, at your problem, objectively, scientifically, carefully, from an entirely new angle. Together, we're going to challenge the limiting beliefs, the destructive ideas, patterns, habits, and the negative thoughts. I am fully committed in providing a safe, sound, caring, and supportive space for you. Thank you for your time, and I'm looking forward to meet you in our first session.